Dr. James Thomas, Professor of Social Research and Policy based at University College London. His research covers public health, education, as well as computer and information science. He has written extensively on research synthesis, including methods for combining qualitative and quantitative research in reviews. He is a senior scientific editor of the Cochrane Handbook and a concert pianist. And you will hear more from him during next week on machine learning and crowdsourcing to improve the efficiency of systematic reviews. But for today, he will be speaking about complexity involved in conceptualizing the public health and system level interventions.
And thank you very much for the invitation to join this session. Sure, it's going to be very interesting. Already there are some synergies I can see between what John was saying and some of the keywords that I'm going to be talking about in this little talk as well. So I think there's going to be a sort of like a good thread running through the evening or the morning or the afternoon, wherever you are. So I thought I would probably it would help if I orientated myself slightly for those of you who I've not met yet. I've worked at this place called the Epicenter for a long time now. That's the building. I've not seen it now for a year, but apparently it's still there. I've been doing systematic reviews, mostly for the Department of Health and Social Care in the UK for many years. And when you're doing systematic reviews to inform policy, what you do find is that you need to address questions that go beyond effectiveness. So I'm going to be talking about that quite a bit. I'm also interested in making review processes more efficient. So I'm looking forward to talking about new tech next week. And my Cochrane roles, I think Tianjing's already mentioned: review author, co-convener of the Qualitative and Implementation Methods Group, Cochrane Handbook, and tech as well. How do I make these advance? There we go. I ought to acknowledge that this work draws on the thinking and the work of many, many people, not least those mentioned here, but not only those mentioned here. And I'm going to be talking about some of the main issues relating to complexity and complex interventions, intervention complexity. I'm going to talk through some of the standard conceptualizations of this that you might have come across before, from simple, complicated, through to complex, and then to complex adaptive systems. And with some trepidation, I'm going to illustrate this with an example going through about face coverings during the pandemic. And I do see myself very much just sort of introducing the concepts here in this session. And I've got this sort of like the pleasurable job of raising some of the tricky issues that complexity raises without necessarily having to offer all the solutions. So to begin with, I thought it would be useful to sort of orientate our thinking. I'm just going to move this so that can you see the slides now if I do that? There we go. So, when we're doing research, when we're reading research, when we're making sense of research, we do so with a set of pre-existing assumptions. Sometimes these assumptions are explicit, sometimes they're not explicit, they're implicit in what we do and what we read and what we value in terms of what we can know and how we can know it. And sometimes what we can do is we can choose which set of assumptions, which theories maybe to use, depending on what is most useful for the task at hand. And I think that's one of the sort of like the key lessons that we've found over the years doing this sort of work, is that actually we can't be too fixed on a particular method or a particular approach to doing something, but actually due to the diversity of questions that we have to address, we find that we need to use different tools, different perspectives, different underlying assumptions, depending on the challenge at hand. The other point at the bottom there, the assumptions also help us analyze the phenomenon of interest, but also communicate about it. And that's particularly important when we get into intervention complexity and complex interventions, where engagement and discussion beyond the remit of the academy is necessary. And this question really lies at the heart of some of the methodological challenges that we encounter here. The assumptions which we bring to the table, our take on what I've called epistemic security here. What does that even mean? Our priorities and our values in terms of what we count as evidence, how we think evidence is being generated and validated. And there are these different ways of thinking causally, and I'm not going to embark on a course on counterfactual and causal thinking, but just to sort of highlight that these issues underpin quite a lot of the debates that we might see. So we've got the counterfactual model, which sort of addresses questions, what would have happened if we had done this or if we hadn't done this? And of course, Cochrane reviews using randomized trials are sort of like a key exemplar of evidence synthesis using that counterfactual model. And it's often set against, though I'll argue it doesn't need to be, against mechanistic models of understanding causation, where something is happening because we understand the properties of a phenomenon, and we understand them well enough to be able to predict what something is going to happen. And these two ways of understanding claims about cause and effect often rub up against each other when we're thinking about complex interventions and intervention complexity. The real challenge we've got here is how we consider how we can provide evidence which is useful and is aligned enough with real world decision making context to actually be able to be used in decision making. So we'll start off with a sort of like a fairly simple causal model, though I want to caveat all this by saying that often nothing is that simple, but the model itself we can articulate as something where if we have a particular action, we know what the cause is, and therefore we can with some security say that we've observed a particular effect and that effect is due to the cause. That counterfactual reasoning I've mentioned before underpins some of the science that looks at causes and effects. And the questions that we often address in systematic reviews are questions around that cause and effect. How often does that cause have that effect? How large is the effect and how consistent is the effect? And so those of us doing meta-analyses will be very familiar with those types of questions. We're interested in consistency and the quantity, the magnitude of that effect. Bring my first slide in on face masks here. On the face of it, they're a fairly simple mechanism. They're a barrier. I'm not unfamiliar with many public health interventions, reducing or preventing SARS-CoV-2 from entering or leaving the mouth and the nose area. So that's at its most basic what the face covering is for. And there are some studies which have addressed questions around whether or not face coverings are able to do that. Can they indeed prevent particles from moving one way or the other? And questions then arise, well, can we say whether or not masks work? And I think one of the key questions is, of course, unpacking the whole idea of what working means in this context, and eventually then in terms of the practical use of masks in real world settings. So, okay, we can see that barriers can prevent things moving from A to B. Obviously, we can talk about particles, but then also there's infection. Does that mean that infection rates change? Okay, so there are studies that have looked at that, cause and effect. But sometimes things get a little bit more complicated than this. Sometimes there are much longer causal pathways between an intervention and outcome. So we think again of our mask example. We've got the barrier, we've got the question about infection, but then maybe what we've got is, rather than the mask itself, we've got an instruction to use a mask. Now we've got an instruction to do something which many people are not used to doing. There's adherence to that instruction, but there's also whether or not we're actually able to use the mask in the right way. There's heterogeneity between different types of masks. So suddenly there are many possible factors that might be influencing an intervention outcome. Plus, when we're thinking from an evidence synthesis perspective, replication is just rare. Sometimes you could say it's impossible to achieve. But what we often find when we're looking at looking at interventions in public health is we get different examples of the same intervention in slightly different populations. We very rarely get precise replications, and that is a real challenge when you're thinking about evidence synthesis. And if you think about that original model of trying to estimate the magnitude and the consistency of a specific effect. So coming back to that example, what we can see here now, suddenly from this idea of a barrier preventing the virus moving from A to B, we've got whole policies around the use of this particular intervention. And here's on the right UCL, which I believe looks like this at the moment with these signs up around. We've got the blue sign there, face covering should be worn at all times when moving around the building, but we've also got another intervention next to it, keep your distance. So we've now got two components of an education or a sort of some kind of intervention on the campus here, which is around keeping your distance and wearing a face covering. These are components of a multi-component intervention. We don't only just have the warnings around campus, there's opportunity to get hold of the things if you need a face covering, but there are also emails. There are other interventions within or other components within this multi-component intervention to reduce transmission on campus. So when we're thinking now, do face masks work? Suddenly, actually, that question seems pretty naive. We're not really thinking anymore about how consistent and how large an effect of this intervention might be, because there's no single effect now. We've got different components of an intervention, no doubt used in different ways in different campuses, and different parts of a campus will have different environmental factors and different rules. So there's no single effect. And often what we find when decision makers are asking us about the effects of an intervention like this, they're not looking for a single overarching effect. What they're wanting to understand is why it might work in one situation and not another, or it might be helpful in one situation and not another. Why was the effect observed in that situation and not others? i.e. what we're wanting to understand is what drives differences in outcomes, just as much as sort of thinking about where actually there is this sort of mythical idea of just one outcome. So we're interested in how the intervention worked or didn't work, under what circumstances it might or not have worked, and what's the relative importance or synergy between these different components. So we've talked about the keep your distance and the wear the face covering, but what's the interaction between the two? Does one reinforce the other, or does actually, if you keep your distance, do you not need the mask? How do these different factors impact on the individual effect on any particular component? And then, of course, what are the mechanisms of action? How is having that picture on the wall or that email arrive in your inbox achieving a reduction in virus transmission on the campus? What are the factors that have impacted on this? Are there particular implementation factors or participant responses? And then, of course, we get into feasibility of actually doing this at scale, the acceptability, which I'll come back to, which then gets this whole interaction between the introduction of an intervention and the dynamics of the wider system. And so that's where we start to be exposed to this idea of a complex intervention. Once upon a time, these were defined as an intervention with lots of different parts. And then there was a sort of a school of thought that challenged that. It said, well, is that really genuinely complex, or is that just complicated? And so the school of thought, which now seems to be sort of hold sway here, is that actually true complexity is more than just multiple components. It's actually thinking about nonlinear effects, which actually multiple component interventions might end up achieving, phase changes where you don't do anything, or whether you see very little result from an intervention until you reach a particular threshold, feedback loops, which we'll come to, causal pathways being less well understood. Exactly what is that causal pathway between the poster on the wall and the virus transmission, either going up or going down or staying the same. Outcomes when we get to this kind of intervention are simply less predictable. Talking of less predictable, introducing interventions into a system don't just involve the mechanics of provision of, in this case, a particular material. We've got the wider social context to consider. So we've now got a whole political dimension and the alignment of people who are anti the idea of wearing face coverings because it's aligned with conspiracy theories about COVID-19 actually not being what people are claiming it is, democracy, and the rejection of actually bad science. Those of you on Twitter, you will have seen this argument going on. You've got sort of like anti-lockdown and anti-mask on one side, and then you've got sort of more public health faces, epidemiology on the other. This is Dr. Ellie Murray's Twitter profile, which I think captures it very nicely. My mask protects you, your mask protects me. That's a sort of like the public health message against the libertarian and the fake news agenda. And I should also say that Ellie Murray's Twitter account's worth following for some of the sort of like the causal information that she puts up there on sort of causal reasoning. So interventions, when they're introduced into a system, the system can respond in very unpredictable ways. And that's where we then get on to complexity and then understanding that actually when you introduce something into a large system, that there's an interaction between the intervention and the system, which actually can be absolutely key to understanding how and why and when an intervention has an effect or doesn't have an effect. Here, what you understand an outcome to being as a property of the system rather than a simple, at the end of an arrow, which at the other end of it says cause. Interventions are understood as perturbations in the system. So there's something that's happened within the system which unsettles sometimes what an equilibrium of the system is, and then the system will respond in ways which may be unpredicted, but often will try and damp down the effect of whatever you've tried to do. So this doesn't actually change what's been introduced here. I think this is the important thing to bear in mind, that we've still got this cloth barrier, and we've still got posters on the walls. That the intervention is the intervention, but what can change and what can help is our understanding of what the intervention is and what are the other factors that we might need to bear in mind in order to understand what's going on and in order to start to predict what might happen if we do X or Y. So not surprisingly, if we've changed some of the types of questions that we're asking, then some of the answers are going to change too. So we've got questions around what we're looking for, the size and the magnitude and the consistency of an effect. We don't find those so much anymore. What we're finding is hopefully explanations and understanding as to why we observe something, why a given effect has happened in a particular place and time. And as I said, variations are one of those things which decision makers value very highly. But in terms of answering some of these questions, what we might start to need is a wider range of different types of evidence. And that's where we sort of hark back to some of those questions or those points I raised right at the beginning on epistemic security, because as soon as we start to step outside of that secure threshold of counterfactual causal claims, then we get into a much more difficult and contested area of understanding or at least being comfortable with using mechanistic claims and causal claims, as well as, or instead of, or aligned with a counterfactual causal claim. So not surprisingly, we've got slightly different types of evidence and types of questions being addressed and being answered. What we find then is actually the evidence product that we come up with at the end can look quite different. So if you've got something which gives you the size, the magnitude, the consistency of an effect, sometimes you can say, well, okay, so I'm going to introduce this intervention here. And a little bit like we're seeing with some of the sort of like the vaccine trials and then the rates of transmission that we're then seeing post-vaccination, we're seeing some of the sort of in a way, quite surprising consistency between the research and actually what we're seeing in practice. Whereas if you've got something which is starting to tell you some of the underlying causes as to why something may or may not be working or being acceptable in a particular context, an enlightenment model of understanding the use of the evidence might be more appropriate, where rather than saying, well, we're going to see this effect if you go and do this, I'll go and do this and I'll see that, what we might be saying is, well, actually, if you introduce this in this environment, so for example, the use of face coverings in an environment where they're unacceptable, you're going to have to think very carefully about how you actually go and introduce that, or you're going to find that you've got a response from the system, which is actually counterproductive, is actually going to do the opposite of what you're looking for. So it doesn't give you a number, it doesn't tell you this is going to be the cause, this is going to be the effect, sort of the outcome of that cause. What it's helping you to do is to understand some of the issues which might underpin implementation. Lots and lots of abstract thinking there, so I thought I would just end with some slightly more concrete advice or questions. I think the real key here is that these should be understood as heuristic devices. They should help us think about what might be important in an analysis, help us think which aspects of a system's perspective might or might not be relevant, and consider which aspects are the most important. What's really important is to consider what are the practical boundaries that would work around a conceptualization of a system and where a particular intervention is located. It's very easy just to sort of conceptualize systems and then draw logic models and I'd end up with that sort of spaghetti diagram that I started with earlier on. And to all intents and purposes, you end up with an almost unoperationalizable systematic review. So this piece of key advice, which is attributed to Einstein, yes, make things as simple as possible, but not simpler. So don't let's just sort of drown in complexity and end up in a situation where we think, well, we just can't answer any of these questions. What we want to do is identify the key components and the key ingredients which we need to examine and not think that we have to model the entire world. I think it's here that we should really sort of fly the flag for evidence synthesis, because you can see that when you're thinking about, even sort of like at the level of the complex intervention, sometimes you need a lot of evidence to sort of cover all of the different angles. And sometimes you don't find that from individual studies. So a systematic review, an evidence synthesis, which brings together the different pieces of evidence which may sort of bear on a particular question, will be particularly good at addressing some of those issues. Systematic reviews traditionally have been very good at addressing those core questions at the beginning of size, consistency of effect. We've been less good at questions of how and why we see variations in effects, and there are good reasons for that. That they start to undermine some of our core, almost philosophical standpoints on the difference between sort of randomized and non-randomized evidence, and making sort of causal claims on the basis of observational evidence. There are, and mechanistic evidence. There are all good reasons for doing this, but it does mean that we're less good at answering those questions that rely on that kind of evidence. And we see systematic reviews rarely addressing questions which require those systems perspective. But you can see they're completely key to understanding the introduction of an intervention in a given system. So the question being asked is absolutely critical. If we stick to answering questions where we're comfortable, then the less we can address questions that grapple with complexity. And so the key methodological challenge, and this is why I've said I'm comfortable asking the questions in the knowledge that I'm not actually answering them, is that we've got to think about how we can provide methodologically rigorous evidence synthesis, which addresses legitimate real-world questions. So that's where I'm going to stop.